anxiety, depression, and insomnia, understanding causes, treatment, and ways to calm down. The increasing prevalence of anxiety, depression, and insomnia in today's society has become a global health concern. These disorders affect millions of people worldwide and often go hand in hand, creating a cycle of distress that can be difficult to break. In this lecture, we will delve into the causes and risk factors contributing to these conditions, explore how they impact individuals, and discuss effective ways to treat them and calm the mind. Anxiety is characterized by excessive worry, nervousness, or unease, often accompanied by physical symptoms such as increased heart rate, sweating, and dizziness. It can be a normal reaction to stress, but when it becomes chronic, it can interfere with daily life and lead to anxiety disorders. Generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, phobias, post-traumatic stress disorder, PTSD. Depression, or major depressive disorder, MDD, is a mood disorder marked by persistent feelings of sadness, loss of interest in activities once enjoyed, fatigue, and disturbances in sleep and appetite. It affects both the mind and body, making it hard to function normally. Persistent sadness or feeling empty, loss of interest or pleasure in activities, fatigue and lack of energy, difficulty concentrating, thoughts of death or suicide. Insomnia refers to difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. It can result in poor quality sleep and daytime impairment, such as fatigue, mood disturbances, and decreased cognitive function. One of the biggest contributors to the rise in anxiety, depression, and insomnia is the modern lifestyle. People face constant pressure to perform well in their personal and professional lives, leading to stress, which in turn triggers anxiety. The fast-paced environment and 24/7 connectivity, especially with the rise of technology and social media, add to the stress load, making it difficult to unwind and relax. The pervasive use of smartphones, social media, and the internet has significantly impacted mental health. Constant comparisons with others, online harassment, and the addictive nature of social media can lead to feelings of inadequacy, loneliness, and stress, contributing to both anxiety and depression. The blue light from screens also interferes with sleep cycles, contributing to insomnia. A sedentary lifestyle is another major contributor to anxiety, depression, and insomnia. Regular physical activity promotes the release of endorphins, the feel-good hormones, while exercise also helps regulate sleep. However, modern lifestyles often encourage prolonged sitting, leading to physical and mental health problems. Poor dietary habits can exacerbate mental health issues. Diets high in processed foods, sugars, and unhealthy fats contribute to inflammation in the body, which is linked to anxiety and depression. Nutritional deficiencies, particularly in omega-3 fatty acids, B vitamins, and vitamin D, are also associated with these conditions. Family history and genetics can play a role in the development of anxiety, depression, and insomnia. Individuals with a family history of mental health disorders are more likely to develop similar conditions. Imbalances in brain chemicals, particularly serotonin, dopamine, and norepinephrine, also contribute to these disorders. Environmental stresses such as economic difficulties, work pressure, social isolation, and personal relationships can contribute to the development of anxiety, depression, and insomnia. Traumatic events, such as the loss of a loved one or abuse, can trigger or worsen these conditions. Financial problems, job insecurity, and poverty can increase the risk of developing anxiety, depression, and insomnia. The constant stress of making ends meet and worrying about the future can wear down the mind and body, leading to chronic mental health issues. An unhealthy work-life balance long working hours and lack of personal time can lead to burnout and mental health issues. The pressure to meet expectations can increase feelings of anxiety and depression, as well as disrupt sleep. People dealing with chronic health conditions such as diabetes, heart disease, or chronic pain may be at higher risk for anxiety, depression, and insomnia. The physical and emotional toll of managing a long-term illness can lead to feelings of helplessness and stress. Drug and alcohol abuse can contribute to or worsen anxiety, depression, and insomnia. These substances can interfere with the body's natural sleep-wake cycle and increase feelings of anxiety and depression. Psychotherapy is one of the most effective treatments for anxiety, depression, and insomnia. Cognitive behavioral therapy, CBT, is particularly useful as it helps individuals identify and change negative thought patterns and behaviors that contribute to these conditions. Exposure therapy, used for anxiety disorders and phobias. Dialectical behavior therapy, DBT, focuses on emotional regulation and mindfulness. Interpersonal therapy, IPT, helps individuals improve their relationships and social functioning. Medications are often prescribed for individuals with moderate to severe anxiety, depression, and insomnia. These may include antidepressants, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly used to treat depression and anxiety. Anxiolytics, benzodiazepines may be prescribed for short-term anxiety relief. Sleep aids, over-the-counter or prescription sleep medications such as melatonin or sedatives may be prescribed for insomnia. Exercise. Regular physical activity can reduce anxiety, improve mood, and promote better sleep. Nutrition. Eating a balanced diet rich in nutrients can help alleviate symptoms of depression and anxiety. Omega-3 fatty acids, vitamins B6 and D, and magnesium have been found to support mental health. Sleep hygiene. Improving sleep hygiene can help treat insomnia. This includes going to bed at the same time each night, limiting screen time before bed, and creating a calming bedtime routine. Mindfulness practices, including meditation, deep breathing exercises, and yoga, can help calm the mind, reduce anxiety, and improve sleep quality. Meditation helps individuals focus on the present moment, preventing them from ruminating on past or future stresses. Deep breathing exercises, for example, box breathing or diaphragmatic breathing. Guided meditation. Progressive muscle relaxation, PMR. CBT techniques, such as reframing negative thoughts, can help individuals manage their anxiety and depression. By challenging irrational beliefs and thought patterns, individuals can break the cycle of worry and sadness that often accompanies these conditions. Maintaining a structured routine helps reduce anxiety and improve sleep. It provides a sense of control over daily life and can help regulate circadian rhythms, making it easier to fall asleep and wake up at consistent times. Socializing with friends, family, or support groups is vital for managing mental health issues. Talking about feelings and experiences can reduce the feeling of isolation and help individuals feel understood and supported. The increasing prevalence of anxiety, depression, and insomnia is a serious issue in modern society, but there are numerous ways to treat and manage these conditions. Through psychotherapy, medications, lifestyle changes, and calming techniques, individuals can regain control over their mental health. Moreover, creating a supportive environment at home, work, and in social circles is essential for fostering long-term wellness. Taking care of our mental health is as important as taking care of our physical health. By understanding the causes, recognizing the symptoms, and seeking help when needed, we can better manage these conditions and work toward a more balanced and fulfilling life.